Thank you so much for joining us. Today we are very happy to have with us Bisola from UK. Bisola is a registered pharmacist. Good morning and thank you for joining us, Bisola.
My great pleasure. Thank you for the invite.
Please, can you introduce yourself?
My name is Bisola SONOIKI, and I have been a practicing UK pharmacist for over 20 years now, and I work across sectors in England. So we have a variety of sectors, probably common to other countries in terms of community, hospital, general practice, which is working with doctors, and also I don't currently work in industry, but I do work across those sectors, which is community, general practice, and the hospital. So that's what I've been doing. That's what I've been up to.
Today with you, you would like to talk about the pivotal role of pharmacists in healthcare system. Right now you are working on UK. Could you please elucidate the role of the pharmacist as a medication expert in UK, general in healthcare system?
Sure. So, in the United Kingdom, in terms of pharmacists are the first port of call for patients in terms of minor health problems. They're quite pivotal in that, especially community pharmacy. There are several of them, depending on the population of the area that they serve. The numbers are meant to reflect that population. So, in terms of the presence of pharmacy, worried well or people that are acutely unwell, usually will go to their pharmacy as a first point of contact. And from there, they know that if there's a need for it to be, their problems to be escalated, they will be sent to the necessary sector accordingly. Beyond the acute care is also prevention. So pharmacists are, again, the first port of call in terms of preventing ill health through education of patients and through medication, and just to ensure that they're using the medication in the right way. The other things that pharmacists are very well known for and used for is a point of reference by other healthcare providers, so your doctors, your nurses, your physiotherapists will refer to the pharmacist in terms of clarification around medication. And so, yes, the ball in terms of what we do on a daily basis is in the counseling of medication to make sure that it is the right medicine for the person, and any questions asked to help with that. And just to ensure that people are taking their medication as they should is the basis of what we do. Patient care is upmost, and ensuring that medication is used properly.
Wonderful. So that's really a key role in healthcare. So that means what you're saying, we can see like many of them is related to medication safety, and also we know pharmacists play the key role also for efficacy. Now, our next question is how pharmacists contribute to ensure safety and efficacy of medication.
Okay. So in terms of, depending on which sector you refer to, in the general practice sector, so in terms of ensuring safety, one of the ways that we do that is to, look at our patient records and just make sure any new evidence-based information that comes out that indicates that we should look through our records and just ensure that people are being optimized in their medication and they're on the right set of medicines for their condition. So those are the ways we help with medication safety. The other way that we help with medication safety is through education of patients. So be it a group knowledge work to ensure that people have information about their medication, again, how to use them, how to dispose of them. So it's not just in the using of the medication, it's also medication that is not used. What do you do with them? So minimize the impact on the waste system so that they're not thrown in the wrong places. So to bring them back to their pharmacy for safe disposal. So in there is a medication safety as well. Medication safety is a very broad term in that it is not just the ingestion of the medication, it is also reducing how many medicines people are on, educating people to know medications are meant to be taken short-term, long-term, what do they do, how do they do it, when they should be taken, what side effects to look out for. That is all medication safety, to ensure that, if you have certain side effects, you need to know when to stop. You need to know what is common side effect, what is an uncommon side effect, what to do, where to go if this was to happen. So medication safety is a very big, broad subject, really, that can go on and on and on in terms of just ensuring that we are best placed to ensure that people are taking what they should be taking at the right time in the right way. In terms of efficacy, will be around the dosing of the medication, to ensure that people know what to take, again, when to take it, and what to expect and when to report back when they have any negative outcome that they're not expecting, and what to do. So is it a case that they come back to us to discuss it, or should they be going to the hospital because it's an emergency? So yes, it's a big topic, and it is something that, it is part and parcel of everyday work that I do, as it is for most pharmacists as well.
That's wonderful. And one thing that really brings my attention is I agree with you when you said, for example, safety is a broader term. And I know here among part of safety is also the drug interaction checking. And I know we have a website here called is drugs.com. Pharmacists in Canada use that more and more often to try to check the drug interaction. I don't know, do you have any specific tools in UK you are using to do this kind of safety check, a website or platform or any kind of specific software?
So yes, there are websites you can go to. Drug.com actually is one of the things that I have recently been introduced to. There are people that already use it. Perhaps our go-to is EMC, or the SPC. So this is the manufacturer's information. And this is really good and very comprehensive because it's divided into professional and into patient. So everyone sort of got their own section. And then within the professional, it carries on and breaks it down into the monograph of the medication, the dose, and breaks it down depending on the groups that are using it, be elderly, child, adult, pregnant, breastfeeding. So it breaks it down into what you need to, special groups. And also it breaks it down into the pharmacodynamics of the medication, the pharmacokinetics of the medication, and it breaks it down into other things in terms of people that have allergies to certain excipients, so as to know what to, sort of stay away from. It breaks it down into the color of the medication, because of course, for some of our patients here, we do help them in terms of adherence to put their medication into we take it out of the original packaging and we put it into like a box which identifies when to take it to make it easier for them to remember to take their medication. So we have people that need that extra support. And therefore within that, it will tell us as well medications that you can take out of the original packaging, what you shouldn't take out of the original packaging, because perhaps they're hygroscopic and they will absorb water. Exposure could denature the product. So yeah, the EMC is one that we do refer to, but it has a lot of it does come under SPC as well. So you hear people saying SPC, and that's the same thing. The BNF, of course, is universal. And I think a lot of people do use it and refer to it a lot. And also in terms of evidence-based guidelines, we use NICE, which is National Institutes for Clinical Excellence. So that is another document we refer to a lot. But there are several, and there are apps as well. People have created apps that are just absolutely brilliant, that give you comparison websites, and it will tell you what medication you can use depending on the parameters of that person. So there are several, and I'm sure there are some I've not even come across yet that people often use, but those are our top ones that we do refer to a lot here in the UK.
Wonderful. Thank you so much for sharing that. That will be really beneficial for people listening this interview. And we know also pharmacist is working on the healthcare system. And in healthcare system, we have like different professional working, healthcare professional, including physician. How pharmacists collaborate with these different healthcare professional in UK in general?
It is becoming more and more prominent, and depending on which sector you work in, and perhaps people that work in the hospital would be quite used to working with different types of multidisciplinary team. In the general practice setting, in the doctor's setting, what we have a multitude of people that I work with, and in terms of working collaboratively together, we have really focused on not just medication anymore, recognizing that there is more to treatment beyond giving people medicine. So it's also looking at people holistically from top to toe in terms of who else could they see? What else should they know? So we have people like social prescribers. So they would go into lifestyle. And in some of the long-term conditions that I manage, lifestyle is extremely important because often enough, the changes in lifestyle can make a massive difference beyond the medication or as an add-on to medication. So where we come in is where medication is identified as being needed, then there will be pharmacist input expected. Where people are challenged with their medication, again, it is working collaboratively. So there's a need to know what everybody does, what role they play, in order for you to know how to work together for the best outcome for that one patient. So we have regular meetings. So if there's a need for a meeting to come together and discuss a particular patient, we'll do that. Or perhaps during some of my consultations, when I identify that the patient will benefit from seeing somebody else beyond the medication that I can give them, I will encourage that and I will facilitate the appointment. So along the lines of, for example, smoking, it's a known problem in things like hypertension, diabetes, and it is something that we recognize that, long term would be beneficial if it was reduced or stopped. Now, I would refer that person to the stop smoking nurse. So it's really important to know who you can signpost people to, because people are not just about medicine. It is also about your bigger team that can really make a difference in that person's life. Perhaps they're challenged with weight loss. They've been trying to lose weight for a long time. So I refer them to the dietitian. And it just goes on and on. Or maybe they have some musculoskeletal problems. I will refer them to the physiotherapist. But in order for me to do that, I would need to know at least a little about what other people do, as much as they need to know what I do, so that we can identify who is best fit to ensure the health and safety of that one patient. So that is how we work together, by knowing each other's, we might not know in depth, but having a good enough understanding so that we can signpost to one another, and we work synergistically like that, asking for knowledge that I don't have in their field to ensure that I have enough robust knowledge to help my patient that is in front of me to signpost accordingly.
That's wonderful. I just want to emphasize that Bisola is a clinical pharmacist, and that's like a field. Maybe in some country we still don't have this. Maybe I don't know if you can just give us like share just some information or some detail about what makes the difference between general pharmacist and clinical pharmacists, like people can have a better understanding, because that's something which developed in UK and some other country. But I believe in French-speaking country, for example, these things is not very developed like in UK. Could you please elaborate a little bit to help us to have an idea?
Sure. So there has actually been quite a lot of debate about the word clinical pharmacist in the setting in England anyway, in that all pharmacists are believed to be clinical. But our clinical knowledge differs from one to the other on the basis that depending on which sector you work in, your clinical knowledge will be higher than other pharmacists purely because of location. So if you're in the industry, and depending on what job role you hold, so if you're in drug design or drug management or drug development, chances are your clinical knowledge will be quite high. But if you're in policy or you're in well, I can't think of any other word, where you determine population management, your knowledge perhaps might not, because you're focusing more on the management of healthcare as opposed to the clinical side of things. Clinical, I guess, will be along the lines of the a bigger knowledge, a wider knowledge around conditions, how to treat conditions, how to manage them, how to ensure the best outcome for managing conditions. So that will be clinical, if you like. So in the community, in terms of our clinical requirements, differs on the sectors that you're in. And places like hospital pharmacy or a general practice pharmacy, perhaps there's a more clinical knowledge just because we happen to be working in that sector. But overall, every pharmacist is clinically knowledgeable, because when you go to university, that is part and parcel of what you'll be taught. But in terms of how much you build on it as time goes by, might start to reduce depending on which sector you're in. But clinically, you're talking about conditions management, knowing your the physiology behind the condition, and being more in depth in the knowledge of the condition, perhaps, and that's what makes you more clinical. But really, overall, all pharmacists are clinical. We're just different levels of clinical abilities.
Wonderful. Thank you so much for this clarification.
Okay.
I think that will really help people to have a better understanding. In UK is like a kind of reference in terms of clinical pharmacy. And I know some people move from different countries to go to do the specialization in UK in clinical pharmacy. So that's wonderful. Grateful for that. Our last question is related to artificial intelligence. Everyone is talking about, some people are using that, but some are still skeptic about using the artificial intelligence. We'll be happy to have your perspective about that in pharmaceutical field, especially in clinical pharmacy.
Artificial intelligence, I think it's here to stay. I think it has been in some way in the system, but perhaps in terms of the utilization of it, it is gathering speed now, knowing the advantages of it. In terms of pharmacy itself, I mean, in the community, for example, the bulk of the work some of the work they do is around dispensing medication, ensuring that the medicine as prescribed by the doctor is given to the patient as safely as possible. This takes a lot of time for pharmacists to do what is required for them in terms of checking it and everything, and ensuring that it goes into the right bags and given it to the patient. Now, the other side of the work that we do, or they do in community at least, is services provision. So artificial intelligence will really help accelerate an increase in service provision, because it can take over the majority of the work required in dispensing. And quite a number of people have embraced artificial intelligence in terms of using robots to do the dispensing side of requirements, so that things are quite, they have a certain pattern, can be programmed into a system so that it can be done without the need for human intervention at every stage. So artificial intelligence is going to be very much a part and parcel of delivering pharmacy services. And for those that are in the know, are actively working in that space to ensure that they have enough within the system to use. Be it the packing of things that a robot can do, be it the chatbots, and in terms of speaking with people 24/7. We have opening times in pharmacies here, and a lot of them don't open beyond 6 o'clock. So, most of them will open between 8:30 and 6. What about, healthcare does never stop. It's a 24-hour business. So what happens outside of those hours? How do people get information without somebody being there? And this is part of where artificial intelligence will come into play, because then you can use it as an opportunity, to get first-hand information pre-programmed, in that it will also hopefully highlight where there's a need for you to go further and seek a different type of healthcare if it's an emergency. So it will help with workforce in terms of, we do have a shortage of pharmacists, in terms of there's so many roles open to us now. So there's a reduced number of people to do those roles. So therefore, artificial intelligence will also help workforce, because if it's there and programmed right, it can do all those things that doesn't really need a pharmacist presence all the time. And it would increase the opportunity to provide services such as contraception services. It will allow for things like vaccinations, which will require some form of human intervention as of now. It will allow for just so many other services that, at this point in time, I cannot think about. But there are so many services and so many opportunities that it would allow if artificial intelligence was brought in, and is already been brought in some fields, to ensure that it's used where it can be used, and it will release the time for pharmacists to do all the things that equally they have the experience and the expertise in.
We are really happy having you today. Any closing word?
Closing words. I guess what I wanted to say is, if there's anyone out there thinking about what should I do, what career should I go in, I'm telling you now, go into pharmacy. I appreciate it differs from country to country. But within being a pharmacist gives you transferable skills and business acumen that allows you to deliver healthcare in a dynamic way for a population according to their needs. We have several challenges in several countries in ensuring that people are as healthy as they can be. Preventative care. So we are pivotal, it goes without saying, in the healthcare arena to ensure that pharmacists as experts on medication are best placed to really drive services, really drive national protocols, really drive population management, really, to do with identification, be it things like hypertension, high problem, diabetes, long-term conditions that unfortunately it is becoming bigger and bigger around the world. So if you're thinking what career, if you're listening to this and you're thinking, I'm not quite sure what I want to do when I get to uni or whatever the requirements are in your own country, I'm telling you now, do pharmacy, because pharmacists really are pivotal to healthcare delivery. Thank you very much for having me.